about, for instance, you mentioned how a person might be a private person, right? And that could be maybe a challenge for them to have to go to a place where they may have to open up, right? Well, the key about a support group, Kamal, is that it's a safe place, right? It's a judgment-free place where people know that they are coming specifically to seek support, right? It's not somebody who has achieved everything, who knows everything, and things like that. No, we're coming for support. Everyone is joining in to get support. So that by itself provides that safe environment where people feel they're not going to be judged, right? And it is critically important because you have to be in an environment like that to be able to open up, right? And if everybody will open up, then you will be able to pierce through and see that you are not the only one with a particular problem. And but maybe there will be somebody who has walked that road before and they have found a solution that works. So you will be able to learn, among the challenges that you have as you're progressing through your bariatric journey, even practical tips, what works, what doesn't work, where to spend your energy, where to spend your focus, where to spend your time, right? All these things that you don't have to discover by yourself through months of struggling, but you can go to support groups and understand what others have gone through, right? And also knowing that others are going through the same challenges could be a skill, may give you a sense of comfort, essentially, knowing that there is a way out, that it's not just you. It's not something that is because you have a particular issue or problem. It is something that others may have encountered. And this sense of common identification with these issues can be really provide a lot of strength to people, right? And then the other aspect, which is very important, is accountability, Kamal. Sometimes if we decide to go alone and then we make plans, we make projects, and we see ahead of things we want to accomplish and do, well, sometimes we may just go and decide not to do it, or we forget it, or we become less engaged in it. When we decide to have a plan and we decide to put a project in practice in a group setting, and then we have to go back to that group, that sense of accountability is very powerful in motivating us in achieving what we do, right? And it's no surprise, Kamal, that bariatric programs that have support groups actually have better success numbers than programs that don't, precisely because these added values that the support group provides are real in their results. So there are various aspects of a support group that are really critically important. That's why we encourage our patients to really, they may not be able to make it on every month, Kamal, but if they can make it, for instance, 6 times a year, that's once every 2 months, that by itself is very, very important. This may be difficult to evaluate in its importance, but equally important, I think, is to go to a place where there is a sense of camaraderie, a sense of community, right? Where you're fostering that a sense of acceptance. We're all in the same journey here, right? We've struggled with weight. We've decided to go with weight loss surgery. We've succeeded. It's transformative, but there are challenges physically, challenges in our daily life, what to eat, how to eat, what are the best foods, right? No matter how much you've learned during your nutrition classes or with your surgeon, answering specific questions pertinent to your own life may be better answered by somebody who may have walked that road and who may be at that support group.
So can I just give you an example to that, just because I'm actually looking at the live feeds. Patient says, very disappointed with the journey so far because they lost only limited amount of weight and blah. So then, because I've been watching this from the beginning, so another patient of ours answered, well, you are still healing. I lost 25 pounds in my first month. Give time and keep your proteins and waters. It's going to happen. And another person comes in, and then we can say these things in the doctor's visit, but when the person who went through the same thing telling you that this is normal, that's a huge support. Just like with the cortisone shot, I got this and I know how it impacted me, right? So that means this is this has to come from someone. Like you and I, we didn't have bariatric surgery. We may not. I mean, you are a clinician. You, of course, you have much better understanding than I, but I can relate to it so much, but not. I didn't go through the same process. I just saw a lot of people went through the same process, but it's not the same as if I did it. So,
Totally.
but when I see these answers, it's so kind of refreshing that I'm like, okay, so we are in the right direction. So this is a really good source of support for these people. Um,
Yes, yes. Like in many things, Kamal, what guides us very often are our own perspectives. We have our own perspective, we have our own expectation of what something is going to be like. And if those perspectives and those expectations are not met, we feel disappointed, right? The journey might be still successful, and yet because our initial expectation was different, then we feel disappointed, right? Instead of celebrating success, that you have lost 30 pounds, you're commiserating because you didn't lose 50 pounds, right? Well, if the expectation was to lose it at a certain time, right, then of course you're going to be disappointed because nobody can predict exactly the amount of pounds any particular individual will lose, right? The pace is going to be different. What we can tell people for certain is that they will lose enough amount of weight for them to become healthy. That is the critical, right? We cannot predict exactly how much they may lose, right? So this kind of expectation, right, Kamal, can be adjusted when somebody who has had the same experience and journey, share their experiences, right? Yes, in my first months, I thought I was going to lose X, and I felt bad about it. But then as I finished the journey, 6 months later, a year later, I find myself having lost more than I thought I was going to lose, right? So that, that telling them, I am 6 months or 1 year ahead of you, and this is what the road looks like ahead. I want you to look ahead that way. That kind of guidance in this community where people know they're sharing the same kind of journey, it's very powerful in readjusting things. And why is this important, Kamal? Because once we feel disappointed because our expectations have not been met, we can lose motivation. And there is nothing worse than losing motivation in this journey, right? If you lose motivation as you're trying to lose weight, you've lost the battle completely, right? So one of the reasons we want to keep these support groups going is because we want to keep that motivation going through the various challenges that people may expect. The challenge may be my expectation were not met. The challenge may be my partner is not supporting me. The challenge may be I'm not finding the right protein that agrees with me. The challenge may be excess skin. What will I do about it? The challenge may be I don't know what I'm looking at the mirror now, when I'm looking at myself. All these are challenges that are by definition going to be new to the person experiencing them for the first time, but they're not new for the other person who's been through that same road. That's why participating in this community setting in a judgment-free atmosphere is extremely important for the success of our patients and our program. And that's why we really invest in support groups so much, because we know how important it is as a component of our program. We are treating a chronic illness, a chronic disease here. So that's the bottom line. We have to all agree on the issue that morbid obesity is a chronic disease. It is a very, very difficult problem to tackle. A lot of people, probably the greater part of our society, hasn't really come to grips with this reality, that this is a disease, that we are fighting a battle that is really, really hard, particularly for the individuals that are suffering from morbid obesity. And people may ask why that is. What is the reason? Why is it so hard to lose weight? And probably the most straightforward answer to that would be because we have a body that is designed specifically to hold on to weight. Our body basically does not know how to lose weight. Every time we lose weight, we try to lose weight, it thinks that something bad is happening to us, and it wants us to go back to the weight we were before or to gain more weight. right? Now, we can argue and discuss as to what was the advantage for us as human beings to have such a body. And the answer to that probably lies in looking at our evolution as human beings over, millions, over thousands of years, where our main threat to survival was lack of food. So it was very advantageous for us to have a body that was able to hold on to energy for as long as possible whilst we were struggling to find food. Well, in the last 100 years, we have transformed our societies in the vast majority of the planet, where food is easily available. In fact, in places like our country in America, food is abundant, overabundant, right? In this situation, having a body that holds on to weight and does not know how to lose weight creates the epidemic that we have. It is no surprise, Kamal, that the rates of obesity in the United States right now have reached close to 40%, right? That's really, really very high. And if it was just a question of weight, okay, you're carrying more weight, okay, you need more clothes. If that was the issue, Kamal, we would not be here talking about that. The problem is that having extra weight actually leads to real diseases like high blood pressure, like type 2 diabetes. And like we were talking about last time, it actually puts us at risk for cancer development as well, right? So it is a serious life-threatening condition, essentially, when we look at it that way. Now, if there is no hope in tackling this problem with diet and exercise, it is obviously imperative for doctors to be involved in helping people lose weight. And the question that we're discussing today would be, would medicine be better? Would surgery be better? Well, there is no such dichotomy, really. Both are good and appropriate in the appropriate circumstances, right? When we are treating cancer, Kamal, we don't say, oh, should I do chemotherapy or should I do surgery, right? We go to the specialist and we listen to them and say, what is appropriate in this stage? Well, the specialist very often will say, well, it depends on the type of the cancer. It depends on the stage of the cancer, whether it's advanced or not. And in some cases, they may even say, hey, we have to do both. We have to do chemotherapy, which is medication, and we have to do surgery. And this is what we have to come to grips with morbid obesity as well. Right now, we are very fortunate right now because we live in a time in which we have more than one effective treatment for different levels of morbid obesity. Clearly, it has been established now without any doubt that for severe types of obesity, surgery remains the gold standard, right? Why is that? Well, because it gives excellent results, it gives long-term results, and also the potential for complications and risks has been reduced to a very low level, right? So that is our to-go treatment. But also, we are very excited because we are seeing development of new medications that are coming up now to help us. If we were having this discussion like 5-10 years ago, come on, we would be talking about drugs that at the most would be helping people to get maybe 5, at the most 10% weight loss, right? Which means that 5-10 years ago, if you tried to do medications for somebody who is, let's say, 300 pounds in weight, at the most, they would be able to get 30 pounds off, right? So from 300, they would come to 270. For somebody who is about, 5'5", 5'6" in height, that weight loss is good, but it's not going to be sufficient really for them to have dramatic results. So when you have somebody who's 5'5", 5'6", and they are 300 pounds, definitely surgery was the answer. Well, now we have medications that actually can do better. Now these medications that we have, they're a class of medications now known as GLP-1 receptor agonists, essentially. These medications have been shown to help people lose even 15%, even 20%, and sometimes 25%. Weight loss in some patients, which means that if somebody was 300 pounds, now they could be looking to losing even as much as 50, 75 pounds, which is significant, essentially, right? Now, obviously, we have to see that those results don't happen in every individual with that reproducible outcome, but there are patients who have been shown to lose that much. So clearly, we have to look at medications as an option, right? But the best way to look at them, at least from us, and we consider ourselves not necessarily just surgeons, Kamal, we consider ourselves metabolic specialists, which means that we are really interested in the weight loss, whichever way we can accomplish it. So we look at them actually as options that are best in specific circumstances, right? So if you have somebody, for instance, who is, 210 pounds and they need to lose 20, 30 pounds, that patient might be better off with medications because probably depending on their height, their body mass index may be 32, 33, right? But if you have somebody who is 350 pounds, come out, right? And they need to lose 100 pounds. They need to lose 150 pounds. Clearly, surgery is the best option for them, right? So just looking at the weight loss, this would be the thinking that would come up, right? But beyond that, we have to look at the long-term effectiveness. So far, what we have seen, Kamal, is that when patients are placed even on these powerful medications, they have to stay on those medications almost indefinitely for that weight loss to be maintained. What the studies have shown is that when people actually get off the medications, the weight tends to come back.
Can we repeat that again? So they have to stay on it.
That is correct.
For,
yes, absolutely.
Forever.